Alright, so I didn't really plan on doing this, so you have to excuse the lighting, the setup. Um, really what happened was I was looking online at other people's experiences on post-op microdiscectomy, and I thought, wow, this is really helpful. Maybe I have something to add. So I've watched quite a bit of the videos. Gene is one of them, and there's a couple of others. So thank you guys. You did a lot to help me see what the road ahead is. And I'm going to try to cover things that are different that they haven't covered. 2 days post-op. I have just out of the hospital. Still got my my bracelet on. Just a little background. So I was dealing with pain probably since a year ago. Initially I thought it was muscular. I'm relatively young, 35. At the time I was 34, so they thought, okay, probably muscular, take some anti-inflammatories and you'll feel better. And I did. Then I felt so much better. I even went on vacation. Didn't have to take anti-inflammatories during that time. Came back, got back to my daily activities, including jiu-jitsu training. There's a lot of twisting and bending involved in that. And sure enough, the pain came back and even worse. So I knew I was dealing with something else. I went ahead and went to see the specialist, finally got an MRI, got diagnosed with L5-S1 herniation, and that was in January of 2012. The pain had started about May of 2011, so it took that long for me to get a definitive diagnosis. I knew from the start that the pain was different, that it wasn't muscular. I've had workouts in the past where, you get muscle strain and you rest it off and things come back. So I guess my first tip would be that if you suspect that this is a different type of pain that you've never experienced in your life, then you don't wait so long to push the doctors to get to the definitive diagnosis, especially if you're younger. If you're younger, they might think, oh, what are the chances that it's a disc injury? I was actually told by my specialist it's one of the most common injuries in 20 to 40-year-olds, but it seems like most general practitioners don't know that. So I think my general practitioner thought it was just an inflammation and put me on some anti-inflammatories, thinking it was muscular. So my first tip is get diagnosed as quickly as possible, because then you can start dealing with it. As soon as I was diagnosed in January, I did not rush to surgery at all. I did physical therapy. I did an epidural injection, which made things worse for me. I know it's helped a lot of people, but for me it actually made things worse. One of the worst pains I got was immediately following the epidural. Essentially, you're putting more fluid into an already cramped space. So for a lot of people that have a herniation that's pressing upon a nerve, an epidural might not be the best answer. For some people, it reduces the inflammation enough that it helps. For me, it did. So I didn't even go for a second or a third. I told my doctor I'm not doing epidurals anymore. I did physical therapy, chiropractor, acupuncture. Nothing helped. The meds just kept going up and up. I started on Vicodin, then went up to Norco, then went up to eventually towards the last 3 days before surgery, ended up taking Percocet, and did not like the feeling of being stoned on these meds. And really, one of the number one reasons for me to consider surgery was nothing else was working, but also the meds needed to control the pain were going up. And I teach for a living. I stand in front of a class and I give lectures, and the meds were affecting my everyday life. I was sometimes mixing up the words that I was saying. It was getting me through the day, but it wasn't sustainable, and the amount of meds needed were going up. So that would probably be my second tip is don't rush into it, but also don't wait too long. If you do get a diagnosis, go ahead and consider if you're considering microdiscectomy or surgery as an option. Figure out what's right for you. Don't rush into it, but then don't wait too long. Meds are not a sustainable answer. My surgeon was quite honest. He said you can wait this out 4 to 5 years, and some studies have shown that the surgical group is the same as the non-surgical group after 4 to 5 years. So your body does take care of it eventually, but that's 4 to 5 years of meds that were increasing already within a year. So I really don't know how sustainable that would have been. So for me, that wasn't an option. Right before the surgery, so a week ago, I had to go off the meloxicam, which is the anti-inflammatory because it can cause bleeding during the surgery. And going off the anti-inflammatory and staying on the other Vicodin narcotic-based medications actually flared up my injury quite a bit, and I was in the worst pain imaginable. That was good and bad. It was bad because it was the worst pain I can imagine. Some of the other videos talk about really bad pain. It was good in that any doubts or fears that I had about doing the surgery went away. I wanted to, you couldn't get me in there fast enough. I realized the potential for this pain, what can happen if the meds aren't on board, or the combination of meds aren't on board, and how awful it could be. And for me, that was just, I needed to go in. I actually went in 2 days ago, and in the morning, they're giving me all kinds of IV meds right before the surgery, and it was still not killing the pain. It was there. I cared less that it was there, but it was there. So the process itself was pretty scary, but I don't think I had time to be scared. I was so consumed by the pain and just get it done. They were all very nice. I think the third tip I would give is do your research on the team or on the doctor that you're going to go in with. I did a lot of research on my doctor. I'm with Kaiser, so I researched different doctors within Kaiser, and I got 2 very good opinions from 2 neurosurgeons. My third tip is don't just go by one doctor, one neurosurgeon. See a couple and make sure that they both agree that this procedure is for you. And they both did. They thought you could wait this out, but your meds are increasing and you're in pain and you're young and there's no need for you to go through this. So they both actually recommended the same procedure. I ended up going with Dr. Choi in Anaheim because he was really highly recommended and he was closer to me. The other doctor, Dr. Brar, was actually the chief of neurosurgeon up in LA, but it was a longer drive, and it was just practicality-wise, it wasn't very practical. So, but I was happy with both. So that would be my third tip. Make sure you're happy with the team. Everything went really smoothly the morning of, and it went really quickly. Eventually, I'm being wheeled into this massive room, kind of like these big lights. I'm loaded on the pre-medication they gave me, obviously, but I'm looking around and I can see the big lights, and then they put that mask over your nose, and I go, whoa, this is it. And she's like, yeah, this is it. And she puts it in, and the next thing I know, I'm waking up, and Dr. Troy's standing right there going, Oscar, you're fine. The surgery's done. You're fine. And I was like, wow, okay. And the first thing I realized is the pain was gone. It was gone out of my leg. There was a sensation on my back, but the pain in my leg was gone. And after a year of having that there, it was incredible. So I'm 2 days post-op, and what I'm feeling now is some sensation down my leg and on my back, but I'm told that's normal inflammation around the surgery site. Definitely not pain. I can stand up. I wasn't able to stand up before the surgery. I could stand up. I could walk around. I've been told to walk as much as I'm comfortable. You do need a lot of help for the first few days, so I'm staying with family. They've been very supportive, very helpful. you can't do a lot on your own. So make sure you have a good support system. Simple things like getting in and out of bed, using the toilet, things like that, you might need help with, so you don't want to be alone afterwards. You might need a special seat to attach to your toilet. You might need some stool softeners after the surgery, because things don't work right away, and it's difficult to pass bowel movements and stuff like that because you've had surgery back there. So these are the sort of like little things that you know, you might need to worry about. I can't shower for the first 3 days, so my first shower is going to be tomorrow. So make sure you have plenty of clean clothes or someone that can provide you some clean clothes that you can change into every day. And other than that, I'm very motivated and happy about the videos that were posted by other people, and thanks. It's made me hopeful that things are going to go well. I'm going to stick to my recommendations. I'm going to be there on the side of caution, and I'm not going to overdo it. Your body tells you what you can and can't do, and I can definitely feel that. I'll walk around for, let's say, about 5-10 minutes, and my body says, okay, it's time to lay down again. And that's where I've been. I laid down a lot today, and walked around maybe 10 to 20 minutes at a time, just around the house, and I laid back down a couple times. Okay? I hope to come back with a lot of great updates, and we'll see how we get on.